Good morning, good afternoon, or good evening, wherever you're watching from. I want to start today with something small that a lot of people over 60 do without thinking twice about it. Sitting with their legs crossed or staying seated for long stretches without moving, believing it's simply comfortable and harmless. For most people, most of the time, it genuinely is harmless. But for a meaningful number of people, especially once circulation starts to change with age, that small habit is quietly working against something your legs are trying very hard to do for you every single day. And by the end of this video, I want to show you the one exercise I recommend more often than almost anything else for exactly this issue. Simple, quick, and something you can start today. Before we go further, tell me in the comments where you're joining from today. I always enjoy seeing how far these conversations travel. And if you find these kinds of simple, practical explanations useful, consider subscribing. Every week, we walk through the everyday signals your body sends, often long before anything becomes serious. Who I am, and why this topic matters, I'm Dr. Everett Cole, and I've spent a good part of my career talking with people about exactly this kind of quiet, easy-to-miss issue. The ones that don't come with dramatic symptoms, just a gradual change that people often explain away as getting older long before they think to ask a doctor about it. Leg circulation is one of those topics. It rarely announces itself with a single dramatic moment. It tends to show up as a slow accumulation of small things, legs that feel heavier by the end of the day, ankles that seem a little more swollen than they used to be, feet that feel colder than the rest of you, or a dull ache that seems to come and go without any obvious pattern. Individually, none of these feel alarming. Together, over months or years, they're often the first quiet signs that the way blood is moving through your legs has changed. What's actually happening inside your legs? So let's talk about what's actually going on, because I think once you understand the mechanism, the exercise I'm going to show you will make a lot more sense. And you'll understand exactly why it works, rather than just doing it because someone on the internet told you to. Your heart's job is to pump blood down into your legs, which isn't especially difficult. That's simply gravity helping it along. The harder job, the one people rarely think about, is getting that blood back up from your feet, all the way against gravity, back to your heart. Your arteries have your heart's steady pumping pressure to help push blood down. Your veins, on the return trip, don't have anywhere near that same pressure behind them, so your body solves this problem with something rather elegant. Every time you contract the muscles in your calf, every single step you take, that muscle squeezes the veins running through it and pushes blood upward, a bit like squeezing a tube of toothpaste from the bottom. Layered inside those veins are also small one-way valves, which snap shut after each squeeze so the blood can't simply fall back down between steps. Doctors sometimes call this whole system the calf muscle pump, and it's honestly one of the more underappreciated pieces of everyday engineering in the human body. Here's the problem. That system only works when the calf muscle is actually being used. Sit still for long periods, a long car journey, an afternoon in an armchair, a desk job carried on into retirement in the form of long hours in front of a screen, and that pump simply isn't doing its job. Blood pools lower in the legs. Fluid seeps out into the surrounding tissue, which is where that end-of-day ankle swelling often comes from. And over years of this pattern repeating, day after day, the veins and valves themselves can become stretched and less effective, which is part of why circulation issues tend to become more noticeable as people move further into their 60s and 70s, even in people who were never especially unwell. Why people ignore it, and what happens if they do? I think the reason so many people ignore this for years is precisely because none of the early signs feel urgent. A slightly heavier feeling in the legs by evening is easy to blame on a long day. Mild ankle swelling is easy to blame on standing too much, or the weather, or simply getting older. None of it hurts enough, on its own, to make someone stop and ask a doctor about it. But left unaddressed over years, this pattern can gradually worsen. More persistent swelling, visible veins becoming more prominent, skin changes around the ankles, and in some people, a real and meaningful drop in how comfortable it is to simply stay on their feet through the day, which matters enormously for staying active and independent as the years go on. Now here's the hopeful part, and I want to say this plainly because I don't want this video to leave you feeling like this is simply an inevitable part of getting older that you're powerless against. It genuinely isn't. That calf muscle pump we just talked about responds remarkably well to regular use at almost any age, and one of the simplest, safest, most effective ways to keep it working well is a single exercise that takes less than 2 minutes a day. A story that illustrates this well. Let me tell you about someone I'll call Margaret, and I want to be upfront that this is a composite picture drawn from patterns I've seen many times, not one specific patient's medical history. Margaret was 71, a retired librarian, and had noticed for a couple of years that by the end of most days, her ankles looked visibly puffier than they had in her 60s. She assumed it was simply part of getting older and mostly worked around it, propping her feet up in the evening, wearing looser shoes as the day went on. It wasn't painful, so she never raised it with anyone. It came up almost by accident, at a routine checkup, when she mentioned in passing that she'd started doing a lot more sitting since retiring. No more standing at the library desk all day, just a comfortable armchair and a good book for long stretches. That detail was really the whole picture. Her circulation hadn't gotten worse because of some new illness. It had simply lost the regular muscle activity that used to keep that pump working well, almost by accident during her working years. The change wasn't dramatic. She started doing a simple exercise, which I'll walk you through in a moment, a few times a day, and paired it with standing up and moving briefly every 30 to 45 minutes, rather than sitting through an entire afternoon. Within a few weeks, the evening swelling was noticeably less. Within a couple of months, she told me she'd almost forgotten it had ever been a daily thing to plan around. Let me ask you something. How many of you have noticed your ankles feeling puffier by the end of the day, especially since spending more time sitting than you used to? Write about it in the comments. I read these, and they genuinely shape what we cover in future videos. Now, let's get to the exercise itself, because I think once you see how simple it is, you'll understand why I recommend it more than almost anything else for this particular issue. The exercise. The exercise is called an ankle pump, and it is genuinely as simple as it sounds. Here's how to do it. Sit comfortably in a chair, or lie down if that's more comfortable, with your legs relatively straight out in front of you. Point your toes away from you, as far as comfortably possible, then pull them back toward you, as far as comfortably possible, and repeat that motion, point, pull, for about 15 to 20 repetitions. That's one set. Aim for 2 or 3 sets like this, a few times through the day, and if you're able to, add a slow ankle circle in each direction afterward, which brings a few more of the surrounding muscles into play. The reason this particular movement works so well is that it directly activates that calf muscle pump we talked about earlier, without requiring you to stand, walk, or do anything remotely strenuous. It's something you can do sitting in a chair while watching television, sitting on a plane, or lying in bed before getting up in the morning. The muscle contraction is genuinely doing the same job it would do if you were walking, squeezing those veins, helping blood move back up toward your heart, just without needing you to actually be on your feet. I want to be honest with you about something important here, because I think it matters more than the exercise itself. This isn't a replacement for regular movement generally. Walking remains one of the best things you can do for circulation, full stop, and if you're able to take a short walk regularly, that should absolutely remain part of your routine. What the ankle pump offers is something walking can't, a way to keep that pump working during the long stretches of the day when walking simply isn't happening, whether that's a long car journey, a flight, or simply an afternoon that got away from you in a comfortable chair. A few common mistakes worth knowing. There are a couple of small mistakes I see people make once they start this, and they're worth mentioning. The first is doing it once, feeling nothing dramatic, and assuming it isn't working. This is genuinely a cumulative habit, not a single fix. The value comes from doing it consistently, several times through the day, every day, not from one heroic session. The second is only doing it when the legs already feel heavy or swollen, rather than doing it proactively through the day regardless of how things feel in the moment. The whole point is preventing that pooling from building up in the first place, which means it works best as a regular habit rather than a reaction to discomfort that's already arrived. And the third, which I think is the most overlooked, is forgetting the other half of the equation, simply breaking up long periods of sitting. Even the best exercise in the world, done for 2 minutes, doesn't fully undo 3 hours of complete stillness afterward. Standing and moving briefly every 30 to 45 minutes, even just to walk to the kitchen and back, does far more good alongside the ankle pumps than either one does entirely on its own. The turning point worth remembering. I think the biggest mistake I see, and it applies to circulation just as much as almost anything else in this line of work, isn't that people ignore their health entirely. It's that most people wait until their body essentially forces them to pay attention. Persistent swelling that won't go down. Discomfort that finally becomes hard to ignore, rather than addressing something small and manageable while it's still small and manageable. The ankle pump is genuinely one of the easiest, lowest effort habits available for exactly this reason. It costs you 2 minutes. It asks nothing dramatic of you, and it works quietly in the background, the same way the problem itself built up quietly in the background over years. When this is ordinary, and when it needs a doctor, I want to spend a moment being genuinely clear about the difference between ordinary, everyday circulation changes and something that needs proper medical attention, because I don't want anyone watching this to either dismiss something serious or worry unnecessarily about something harmless. Mild ankle swelling that builds through the day and improves overnight, especially after long periods of sitting or standing, is generally the ordinary, ankle pump responsive kind of issue we've been discussing today. However, there are specific signs that are genuinely worth contacting a doctor about rather than simply trying exercises at home. These include swelling that's noticeably worse in one leg than the other, especially if it comes on suddenly, which can occasionally signal a blood clot and deserves prompt medical attention. Pain in the calf that consistently comes on with walking and reliably eases with rest, which can be a sign of reduced blood flow in the arteries themselves rather than the vein and valve issue we've focused on today, and is a genuinely different condition requiring its own evaluation. Skin that becomes unusually discolored, cold, or develops a wound that isn't healing well, particularly around the lower leg or foot. And swelling accompanied by shortness of breath or chest discomfort, which should always be treated as urgent. None of what I've described today is meant to replace a proper evaluation if any of those signs apply to you. The ankle pump exercise is a genuinely useful, low-risk habit for ordinary, everyday circulation support. But it isn't a substitute for medical care if something more specific is going on, and I'd always rather you ask a professional than guess. So let's bring this together. Your legs rely on a genuinely elegant system, the calf muscle pump, to help move blood back up against gravity, and that system depends on regular muscle activity to keep working well. Long periods of sitting, which become more common as people move into retirement, quietly reduce how often that pump gets used, and over years, that can lead to the kind of ankle swelling and heaviness a lot of people simply write off as getting older. The ankle pump exercise, pointing and flexing your feet, a few sets, a few times a day, directly supports that system, costs you almost nothing in time or effort, and pairs well with simply standing and moving every half hour or so through the day. You are not powerless against this. Small, consistent choices, repeated daily, genuinely do add up to something meaningful over months and years, and staying comfortably active on your feet is very much something within your own control. If this information helped you, share it with someone you love. Sometimes one simple piece of knowledge like this can genuinely change someone's next few years of comfort and mobility. Tell me in the comments, what age are you watching this at, and which part surprised you the most? And subscribe for more science-based health information for living stronger after 60.